one tiny vitamin could help your heart, your bones, your brain, and maybe even protect your kidney and prostate. Most people have never heard of it, but scientists say that it is one of the most nutrients for long-term health. If you have not heard of it, then stay tuned. Today, we talk about vitamin K2, not just for heart health, but for the whole body health. Hi, I'm Dr. Joshua Derito, a family physician. Here, we break down science into simple steps that you can use today. If you want better health without confusion, you are in the right place. Let's look at vitamin K2 and your health. Most heart advice focuses on cholesterol, blood pressure, and then blood sugar. But research has now shown that another problem that is very important is not only vitamin K2, but it has a big impact on the process of stiffening and narrowing of your blood vessels. So many times we have thought of calcium, and unfortunately, when we do not have this vitamin K2, then calcium gets deposited in the wrong places. And the unfortunate thing, it then gets deposited in your blood vessels, especially the arteries. And what happens when your calcium is deposited along your arteries, like the aorta, the big arteries that get blood out of the heart or into the heart, your blood pressure, the systolic blood pressure, then tends to go high. Why does this happen? Because the vessels, because of the deposition of calcium, they stiffen up. And so once they stiffen up, the heart has to use more force to try to push blood through these stiffened and narrowed arteries. And this is why your calcium should only be in your bones and not in your blood vessels. Then another place that calcium can get deposited is in the valves. The valves are the what closes, they control the opening and the closing of your the heart arteries, not the heart atrium and the ventricles. These are where blood gets in and is pumped out. So if these valves become stiffened, then they do not close as appropriately as possible, and so either they are not able to close appropriately, and so you do not pump adequate blood, and you also don't hold adequate blood as you should, and this compromises the efficiency of your heart. So when atrial calcification happens, this can lead to heart diseases, leading to heart attacks. It can lead to strokes, and it can also lead to heart failure, from what I have explained. So vitamin K2 helps to direct calcium to the right places, and where calcium should be is in your bones, not in your heart, not in your blood vessels. And studies have shown that people who have high levels of K2 intake have less artery calcification. With less artery calcification, they have lower risk of heart diseases, and so calcium stays out of the blood vessels, so they do not have much of the process we have called atherosclerosis. Atherosclerosis is where a normal blood vessel stays like that, and when your blood vessel narrows, it blocks, and so it becomes stiff, and it can even block because the inner part of the vessel is heavily narrowed. So when vitamin K2 is deposited in the right place, then you sustain good bone health. And your bone needs calcium to stay strong, but calcium can do the wrong job if it is deposited in the wrong places. And that is why we need the vitamin K2. So vitamin K2 activates a protein called osteocalcitonin. And these proteins helps pull calcium in bones, thus making your bones stronger, and also maintains the structure of your bones, and it reduces the risk of fractures. So when you have adequate supply of K2, then research have shown that you have better bone density and you have fewer risk of getting fractures. And this is very huge, especially for people who are aging beyond the age of 65, because one of the biggest problems as you age is you lose your bone density. If you lose your bone density, then you lose also, you become more at risk of getting fractures. Of course, K2 does not replace everything. You still need to exercise because exercise is core. And you need both aerobic exercises, and you also need flexibility exercises, and you also need strength exercises, so that you build strong muscles and you build strong bones. Remember, from the age of 30, your muscles start wearing away, and from the age of 20, you stop building your bone and they start getting worn out. So you need to keep exercising, and then if you're exercising, you are eating healthy, then you can supplement with the vitamin K2. So this is very important. So then also let's look at the role of vitamin K2 in teeth and the general dental health. So your teeth are made of minerals, just like the bones. So vitamin K2 helps to activate the proteins that strengthen the teeth. They bring calcium into the dentin and the enamel, that making your teeth stronger, and they also protect you from dental caries, and they also support your tooth structure, preventing you from having dental caries. So some research point to better dental health when K2 levels are good. So you get a good dental structure when you have adequate supply of vitamin K2. So it's not just your bones, it's not just your blood vessels, it is also your teeth benefiting from adequate supply of K2. Then vitamin K2 and the brain. Some early research suggests that vitamin K2 may help to protect the brain. Scientists believe that K2 has an inflammatory effect, and this prevents inflammatory process in the brain that can lead to loss of your brain tissue covering. And this reduces oxidative stress in your brain, which supports brain cells and also protect the memory pathways, that protecting you from diseases like Alzheimer's disease. And this, even if this need more research, K2 might be one of the pieces in the puzzle in the reduction of Alzheimer's disease, and also maintaining good cognitive health as you age. So again, it also protects you from strokes because it keeps the resilience of your blood arteries, thus protecting you from getting strokes. K2 also is very important in kidney diseases. Patients who have chronic kidney diseases, they have poor capacity in bone metabolism, and so they have poor calcium control, ending up with calcium deposition in blood vessels, leading to increased risk of atherosclerosis. This leads to heart problems, and also leads to poor bone formation. And so people who have kidney diseases, they tend to suffer from what we call osteodystrophy, which is wearing away of the bone. And one of the ways that you can support the bone mineral density in people with chronic kidney diseases is supplementation with K2, because this helps to protect the bones and also helps the blood vessels and protect these individuals from getting heart attacks and also other heart diseases. So this is not the cure, but it is promising that when you replace K2 in patients with kidney diseases, you protect their brain, you protect their heart, you protect their bones, you protect their heart and their kidneys. Then there has been some studies that have also shown that K2 is important in protection against prostate cancer. Some research shows that there is a link between vitamin K2 and the risk of prostate cancer. In one study, men who take adequate amount of K2, they lower their prostate cancer risk. And some scientists believe that this may be because K2 helps regulate cell growth, reduce inflammation, which is a key factor in cancer development, and they also help good cell signals, especially in the mitochondria, which is the powerhouse of the cells. And this does not mean that K2 protects you from cancer, but it may be an element of a healthy lifestyle that can reduce your risk of getting prostate cancer. So I've talked about this K2 vitamin, and I've told you the importance of getting adequate amounts of vitamin K2. So where do you get it from? You get from vitamin K2 from one, fermented soy. Vitamin K2 is a common component of fermented foodstuffs. If you want to know more about fermented foodstuffs, you can check in the Overall Health YouTube channel. Then hard cheese, the soft cheeses, egg yolk, butter, chicken. I've talked about fermented food and the animal liver. These are good sources of vitamin K2. And then also supplementation. When you cannot get adequate supplies of these vitamins, then you can supplement with the K2 supplements. You need about 200 micrograms of vitamin K2 on a daily basis. And so you can take it as a supplement, and you can take it combined with vitamin D. But before you start supplementing, it is also good to talk to your doctor, because one of the risks is that vitamin K2 interferes with the clotting system. And so if you are taking drugs that help in the anticoagulation and you are taking vitamin K2, then this might be affected, and so you need to talk to your doctor. And just like before you supplement anything, it is always good to talk to your doctor, so for professional advice on what you need to do. So vitamin K2 is not just a magic pill, but it plays a major role in your heart health. It plays a major role in your bone strength. It plays a big role in your teeth health, brain resilience, your kidney protection, and also for men, lowering the prostate cancer risk. And that is very powerful. If this video has helped you, like it, subscribe to the Overall Health YouTube channel at Dr. Derito, and also share it with someone whom you think might benefit from supplementing vitamin K2. And comment below, did you know about vitamin K2 before today? Let's keep learning. Let's keep growing together. We meet in our next video. Thank you for watching.